My team and I help put patients first by accurately reporting and capturing data to improve patient outcomes.
I put patients first by being sympathetic and empathetic with them and understanding, putting myself in their shoes, try to understand what they're going through. That way you can provide better care, putting yourself in their position.
Every day that when I look at each one of these residents, they're like my family. They're my mom and dads. And as anybody who works with me, that's what I tell them every day. That's just imagine you're serving your mom. You have your dad here. You're talking to your mom and dad. Be respectful of them, right? And do what you can to make their lives happier.
I believe that giving them their choices and make sure that their voices are heard. It's not about what we want to do for the resident, but it's about what the resident wants us to do for them.
So any needs, maybe temperatures or making the stay for the patients comfortable, I would service that, putting the patients first.
So I'll go out of my way I think sometimes even if you take 2 minutes to go and talk to them and just give them a little hug when they look down, it totally changes their day and it also makes me happy.
I would talk to them like on a human-to-human level with my job aside and just trying to really get to know their needs and how they're feeling, if they're feeling any pain, and just trying my best to just accommodate them and make them feel comfortable, safe, and happy.
When we go for the patients, we always introduce ourselves and we tell them that where we are taking them. And sometimes if we take them to OR, they are a bit nervous. And so we tell them that not to be nervous, everything will be fine.
If we live long enough, we're all going to end up in a facility like this one. And I try to picture how I would like to be treated in my later years. And so I try to emulate that with my residents, whether it's some extra kind words or a hand on their wrist during difficult conversations.
I always treat them kind. I'm friendly, outgoing. I show them where to go. I take them to their areas.
In my daily interactions with our patients and our families, I try and put myself in their shoes and to figure out what is their story. Everyone has a story. And we are human first. I take time to listen to figure out what's the root of what they're really asking me. So daily, that's what I try and do. Think about where they're coming from first, and then see if I can work backwards and figure out what they need. How I put my patients first.